Thank you for tuning in. My name is Felicia Yensua, and if you are new here, welcome. And if you're returning, thank you. You really believe in me. I've made another video. Woohoo! Anyways, let's get into it. In today's video, I want to talk about why the coronavirus is giving us racist vibes. Yes, racist vibes. So if you're a human and you're living on planet Earth, then you know we've been going through it. Not only have there been so many riots popping out as a result of Black Lives Matter, we are also in the middle of a pandemic. Yes, it's a pandemic. I know this is crazy. Never in my 20-odd years of life did I think that I would ever experience this. It's a shambles, but we're surviving. Barely. But yeah, it's crazy. One interesting thing we're seeing from this pandemic is how it's having a disproportionate impact on ethnic minorities and exposing deep inequalities that have already existed in society. I'm sure you've all seen these crazy ass headlines. Black Britons face twice the risk of death, says the ONS. Black people in the UK are 4 times more likely to die from Covid-19 than white people, new data shows. These headlines are mad. And they lead us to ask many questions, like how the hell can a pathogen with no eyes, no ears, not even any kind of consciousness, differentiate between its victims? And why race is the marker of differentiation? Is this virus racist? Okay, so maybe the coronavirus itself isn't racist, but what it's doing is exposing deep structural health inequalities and how they do vary by race. Just so that we understand and we're on the same page, here's a definition of health inequalities. Health inequalities are systematic differences in health outcomes or in the distribution of health resources between different population groups. It's important to know that they do arise out of social conditions of which we are born, live, work, grow, and they are influenced by a wider set of systems and forces that shape our daily conditions of life. They shape our conditions of daily life. These systems and forces are widely and most likely beyond individual control. It is also important to note that these inequalities are not fixed. No, they're not fixed. They can be changed. They can be changed with the right policy measures and or actions. So let's bear that in mind when we're talking about health inequalities. Now, I want to get into a little bit of the data and the stats and the recent report that's come out. But before that, I really think it's important that we debunk some untruths. 1, that the coronavirus is having a disproportionate impact on Black and ethnic minority groups because of the way we're set up biologically. No, do not accept this. This is an untruth. Why? Because race is a social construct, and also race is not an adequate marker of genetics or biology. There is more genetic variation within racial categories than there are between racial categories. So there you go. Number 2, this idea that the reason why different groups are disproportionately affected by COVID-19 is because of our lifestyle, our eating habits, the way we do our things, and all of that jazz. No. Yes, whilst we are individuals, and as an individual, you can do things to help reduce your risks, you can do things to improve your diet, and just make sure that if you were to capture any illness, your immune system is stronger. These health inequalities are not a result of individual behaviour. On top of that, by putting the blame on individual behaviours of a certain culture, what you're doing is invoking stereotypes about those people or about your own people that help to justify structural inequalities that have existed. That's because you're not looking at the real factors as to why these things are existing. Anyways, now that we've got that out the way, we've made it clear what this isn't and what this is not, the figures from those headlines are really crazy and we want to know what's going on. And rightly so, there has been further calls for investigation into these figures. So there's analysis out there that's been done by the Office of National Statistics as well as the Institute of Fiscal Studies. More interestingly, analysis has been done by Public Health England. Their report has come out earlier this month, which was the 2nd of June, I believe. It was delayed, and Sky News put out some news saying how, they're going to delay this report because of the protests and the rioting, and that did not make sense, and I'm so glad it was released, which is great news. So let's delve a little bit deeper into what is going on. So the review itself is 89 pages long and divided into 8 different sections. Each section focuses on a different factor, whether that be occupation, whether that be age, whether that be location, as well as ethnicity. And it does so separately. And when I say separately, it means that each factor is analysed separately and there is no analysis of the interactions between them. So given that this video is focused on the ethnic disparity, let's skip ahead to the ethnicity section. So ethnicity in this review is broken down into 5 large categories. That's white, Asian, black, mixed, and other. Other is a bit of a weird one because it's just basically saying if you're not black, white, mixed, Asian, then you're just in another category. And I believe it includes Arabs and Chinese people, but please double check in the appendix if you're looking at the report, because that's what I think it is. And it's just basically saying if you're not in these main groups, you're just in other groups. So it's a bit sticky if you want to know what's going on with your ethnicity and you're not in those other 4 main categories. So here's a brief summary of what's going on according to the review. Cases and diagnosis. The diagnosis rate per 100,000 population is highest amongst black people and lower amongst white people. The report found that 15.2% and 9.7% of critically ill patients were from Asian and black ethnic groups respectively. Now on to death rates. Death rates from COVID-19 were highest amongst black and Asian groups when compared with white groups. For the males, black males were 3.9 times more likely to die than white group, compared with 2.5 times in the Asian males, again compared to the white group. Amongst females, death rates were 3.3 times higher in the black ethnic group and 2.3 times higher in the Asian ethnic group when compared with the white group. Now, as you can see from the graph, after other, black men and black women have the highest death rates when compared to the rest of the ethnic groups. Important caveats to bear in mind. Whilst the analysis does adjust for age and deprivation, it does not adjust for comorbidities or obesity, which is likely to have an impact, according to this report, on the figures that we're seeing. Now let's move on to the baseline. So the baseline is important because it gives us a sense of how severe the situation is. It lets us compare what we would expect the death rates to be in absence of the pandemic and what they are now with the pandemic. In this case, the baseline chosen is the death rates of all cause deaths. So that's basically the general death rate for each ethnicity in previous years. So looking at the death rates for all the ethnicities, we see that the death rate for the white ethnic group is higher than that of the black and Asian ethnic groups. However, now that we have COVID-19 and we're in a pandemic, the black and Asian ethnic groups' death rates are much higher. What's interesting to see is that not only is that because of COVID-19 itself, but non-COVID deaths have also gone up. And this can probably be linked with the next section, which is excess mortality. Excess mortality refers to the number of deaths that we would expect at this time of the year compared to what we're actually observing given the pandemic. So whilst there's been an increase in excess mortality across all ethnic groups, we see that the highest increase has been amongst the black ethnic group. For men, this is almost 4 times more higher, and for women, this is almost 3 times more higher than what we would expect. So that's basically the key findings and the key understandings from this review on ethnicity. If you do want to see more, I definitely recommend you do read it and do some research around it yourself. But what can we actually take away from this? Overall, this report has given us a good overview of the descriptive stats surrounding the situation. And the bottom line of this report can be summarized in this simple quote. The impact of COVID-19 has replicated existing health inequalities and in some cases has increased them. So that's all well and good. However, it doesn't really offer any new insights and kind of already tells us what we already know. In addition to that, there are some really crucial caveats that limit this report from really telling us what's going on. It doesn't analyze the interactions between all these different factors. So it doesn't look at ethnicity and how that interacts with occupation or deprivation. And this is really important because it's these interactions that are responsible for the inequalities in the first place. So if we don't know how these things interact, we don't know what to do about it. And I guess that's why this report hasn't given any recommendations either, for the time being. However, it does acknowledge that this is the case. The report does explain, very briefly, that those of BAME ethnic groups are more likely to be living in deprivation, more likely to be in jobs where they're more exposed or at risk to the virus, and also more likely to be born abroad, which means they have difficulties in accessing the vital healthcare service they may need. Despite all of this, the good news is that they are going to continue with this investigation, and hopefully we can see some recommendations on what's going to be done. So, in conclusion, is the coronavirus racist? Nah. But whilst the coronavirus itself may not be racist, what it is doing is exposing that even in the context of a pandemic, we, yes us, we, have created conditions in which health inequalities prevail or are even worsened. It's kind of hard to say where we go from here, especially since the report doesn't make any recommendations or view the interactions into how these inequalities have come about in the first place. Maybe a good thing that's come out of this report is that we can finally put aside some of the stuff that we may think, like some of the stereotypes that the racists keep spewing out there. But what's really important is what happens next. It's really important what happens next so that these inequalities are not further entrenched. So that's it for today's video. I hope you were able to get something from it. You were able to be informed. And if you're interested, you like this content, let me know. Maybe drop a comment, maybe hit that like button, maybe it's a little bit cheeky, but you could subscribe. But yeah, that's it from me. I'm Felicia Yenswa. See you next time.